Obsessive compulsive disorder, also known as OCD, started in the 17th century. Obsessions and compulsions were symptoms of religious sadness. In the 19th century, France and Germany discovered OCD, and ideas changed. Obsessions were delusions, and compulsions were impulses. About 3.3 Americans suffer from OCD in a year. The ages range from 18 to 54. People with this disorder suffer from unwanted thoughts, which are obsessions, or rituals they perform without thinking, which are compulsions. Some suffer from both. 1 out of 3 cases of OCD begin in early childhood and progress in the late teens and adulthood. It affects both men and women equally, but men begin to seek treatment earlier than women. To be diagnosed with OCD, obsessions and compulsions must interfere with everyday life and be present for more than an hour in a day. Doctors use the Yale-Brown obsessive-compulsive scale to rate a person's severity of OCD. It focuses on time, interference, degree of distress, resistance, and control. Points are ranged from 0 to 4 with no symptoms to extreme symptoms. Only doctors and trained therapists can diagnose OCD. People may not see that their obsessions and compulsions are serious. Obsessions must be unwanted and compulsions must be repetitive and done to reduce stress. Doctors will perform blood tests and ask questions about your thoughts, feelings, and rituals. Causes of OCD is the abnormal functioning of the striatum in the brain. People who have close relatives with OCD are 9 times more likely to have it than people whose family members do not have it. Other causes are problems with the serotonin level or chemical messengers in the frontal part of the brain and stressful life events. Signs, symptoms, and behaviors include having obsessions, compulsions, or both. Obsessions include fear, order, violence, sexual, and religious subjects. Signs of obsessions include fear of contamination by touching something or someone, doubts of leaving something on or unlocked, hurting themselves, others, or both, avoiding situations, and having unpleasant and unwanted thoughts. Compulsions are repeated actions, rituals, and behaviors that reduce stress and anxiety. This may include washing and cleaning, counting, checking, routines, and putting things in order. This may include raw skin from washing hands frequently, checking home appliances and doors, counting patterns, repeating words or phrases, and turning objects to make them face the same way. Treatment for OCD does not always mean that it's cured, but it can be controlled. Psychotherapy uses exposure and response prevention, also known as ERP, to expose someone to their fears or obsessions and teach them how to cope with them. Antidepressants are given to patients with OCD for medication. This includes Anephrino, Luvox, Paxil, Prozac, and sertraline. Weeks or months could go by before starting to see improvements with your OCD. There is really no way to prevent OCD, but getting early treatment can help. To cope with OCD, take your medications, pay attention to warning signs, learn about OCD, join support groups, set goals, find healthy outlets, and stick to daily life activities.